All right, let's talk about a medication that has been an absolute game changer for so many people, Sumatriptan. If you've ever dealt with migraines, you've probably heard this name. Today, we're going to break down exactly what it is, how it works, and why it's so different. But before we get into the solution, we've got to understand the problem. So why isn't a migraine just a bad headache? Well, if you know, you know. It's not something you can just push through. We're talking about a full-blown neurological event, debilitating, throbbing pain, often with nausea, and a crazy sensitivity to light and sound. It's a whole different beast, and it needs a specialized weapon.
So here's our game plan. We'll start with what makes this a different kind of painkiller. Then we'll get into the cool science of how it actually works. We'll look at the different ways you can take it, what you might feel, the side effects, and then some really, really critical safety warnings. And we'll wrap it all up with the key takeaways you absolutely need to remember.
Okay, let's dive right in. The first thing you have to understand is that Sumatriptan is not your everyday, run-of-the-mill pain reliever. You wouldn't pop one for a twisted ankle or a simple tension headache. Nope, this is a precision tool.
And this little chart really says it all. You see, ordinary painkillers are kind of like a blunt instrument. They just try to dull pain in general. Sumatriptan is different. It's what's called an abortive therapy. Its job isn't just to mask the pain. Its job is to go in and shut down the entire migraine attack right at the source. It's designed specifically for migraines and cluster headaches, and that's it.
So how in the world does it do that? How does it work inside your brain? This is where it gets really fascinating. A migraine isn't just in your head. It's a very real physical process.
Okay, so here's what's going on during an attack. The blood vessels in your brain start to swell up. They get dilated. At the same time, your nerves go haywire and start releasing all these chemical signals. Scientists have this great name for it. They call it an inflammatory soup. And that's exactly what it is, a nasty chemical cocktail that floods your nerve endings, making them super sensitive and causing that relentless, throbbing pain.
And this is where Sumatriptan comes in, like a superhero with a two-step plan. First, it targets those swollen blood vessels and tells them to constrict, to get back to their normal size. That alone provides a lot of relief. But then, for the second punch, it tells those overactive nerves to just stop. It blocks them from releasing more of that inflammatory soup and stops them from sending pain signals to your brain. It's a two-pronged attack that gets right to the root of the problem.
Now, what's really cool is that Sumatriptan isn't a one-size-fits-all medication. You can actually get it in a few different forms. And that's a big deal, because not every migraine attack is the same, right? Sometimes you need relief, and you need it now. Let's look at the options. You've got the classic tablet, which is the most common and takes about a half hour to an hour to kick in. Then there's the nasal spray. This is awesome for people who get really nauseous during a migraine because, the last thing you want to do is swallow a pill. It works faster too, about 15 to 30 minutes. And then you have the injection. This is the fastest of all, giving relief in as little as 10 minutes. It's a true lifesaver for those incredibly severe, out-of-nowhere attacks.
Okay, let's talk about what happens after you take it. Because Sumatriptan is so active, working on your blood vessels and nerves, it can cause some pretty unique sensations. And it's really good to know about these ahead of time so they don't freak you out. In a weird way, it's often how you know it's working.
A lot of people feel a kind of pressure or tightness in their chest, neck, or jaw. Now, that sounds scary, I know, but it's usually just a side effect of the medicine working, not a heart problem. You might also feel some tingling or numbness, a warm flushing sensation, or just get kind of dizzy and tired. And yeah, the nasal spray can leave a weird taste. The key thing here is that these feelings are almost always temporary, and they fade as the migraine goes away.
And that brings us to what is, without a doubt, the most important part of this whole discussion. Sumatriptan is powerful, and because of how it works on blood vessels, it is absolutely not safe for everyone. Please listen closely to this part.
I just want to pause on this for a moment because this is a really big deal. That amazing ability Sumatriptan has to narrow blood vessels in your head, well, it doesn't just do it there. It does it throughout your body. And if you have certain underlying health conditions, that can be incredibly dangerous. So this is a non-negotiable list. If you have any history of heart attack, stroke, coronary artery disease, angina, which is chest pain from heart issues, uncontrolled high blood pressure, or problems with circulation like peripheral vascular disease, you should not take this medication, period. Using it with any of these conditions could be life-threatening.
All right, there's one other big warning. I want you to remember the number 10. Why 10? Because if you find yourself needing to use Sumatriptan,
or really any acute migraine medicine, on 10 or more days a month, you can actually make the problem worse. It can trigger something called a medication overuse headache, or a rebound headache, where the treatment itself starts causing more frequent headaches. It's a vicious cycle.
Okay, wow, that was a lot of information, I know. So let's just boil it all down and do a quick recap of the most important things to remember.
So here they are, your 6 golden rules. Number 1, it's targeted. This is for migraines, not for just any old pain. 2, use it early. The sooner you take it, the better it works. 3, your choice matters. Talk to your doctor about whether the pill, spray, or injection is right for you. 4, expect those weird sensations. That pressure or warmth is usually normal. 5, know the risks. This is a no-go if you have heart or circulation problems. And finally, number 6, follow the limits. Don't use it more than about 10 days a month to avoid those rebound headaches.
You know, when you step back, Sumatriptan is an amazing example of targeted therapy. It's a medicine designed not just to cover up a symptom, but to go in and fix the specific biological process that's gone wrong. And that leaves us with a really exciting question for the future, right? As we get smarter and learn more about what causes disease, how is this kind of precision medicine going to change, well, everything?